Switching topics, when beauty is more than just pain, a foot doctor sets us straight why squeezing into those last size clearance rack shoes may not pay off after all. Stay with us. Welcome back to Studio 5. Frequently cramming your feet into those beautiful shoes you bought one size too small could actually impact the overall health of your feet. Dr. Jason Bruse from Ogden Clinic is here to give advice on how to avoid those unsightly, painful bunions. One of those medical topics we just love to talk about, right?
Yeah, it's my life though, so let's talk about it.
You know what, you're an expert in this field for good reason. It does affect a lot of people. How common are bunions?
It's very common. It's one of the most common things that I see in my office every day. It's much more common in women. Probably because women have a much harder time if they have a bunion. They have a harder time living with it. They have a harder time buying shoes. Whereas men's shoes tend to be wider, and so they can kind of live with it easier.
Yeah, don't get between a woman and our shoes, right?
Exactly.
Well, from a medical perspective, what is a bunion exactly?
It is more than what people think. Most people think that it's just a bump of bone that's grown on the inside of their foot or the inside of their big toe, and it's much more than that. It's a deviation of the big toe joint, and to fix it, it's a bigger deal than most people realize. We have to realign the joint, usually cut the bone and move it, put screws in there to hold it in place.
Oh, wow.
And so it's a bigger deal than people realize.
So how much of it really is just the way our foot is, the way our foot grows, and how much of it can we blame on those beautiful shoes, really?
It's both. So there definitely is a genetic component to it, and most people who have a bunion, they'll say their mom had a bunion as well, or their dad had a bunion, or grandma did, but there definitely is influenced by the shoes that you wear, and no question, if you have a bunion, having tight shoes or wearing high-heeled shoes will make it worse and make it more painful.
So not just tight shoes, but the raised heel affects it as well? Yeah,
but usually having a raised heel usually means that the toe box of the shoe is a little tighter as well, and so it'll influence it for sure.
So proper shoe fitting really does play a factor?
Yeah, it does. And definitely if you have a little bit of bunion or you have a little bit of a hammer toe, then having the right shoes is very important, because well, people who have those conditions realize that because they just can't walk very far. It hurts.
Sure. Is it possible to catch it before you see it? In other words, are there symptoms before you see the bump?
No, I mean, that's usually when people will come see me or ask me about it, is when they have a hard time buying shoes, or they have a hard time hiking or running or doing things that they want to be doing, and there's not really signs before that bump appears.
How do you treat it then? You mentioned kind of the more advanced option.
Yeah, there are theories that you can try to wear a good supportive shoe with plenty of room, a flatter shoe that tries to prevent the bunion from forming, but it's not practical to really do that, and so most of the time what I'll tell people in my office is you live with it until you are sick of living with it, and when it's gotten so bad, then we talk about a fix.
How can they set up an appointment with you?
OgdenClinic.com is where we are, and I'm in Farmington, and we have offices throughout Davis and Weber County.
All right, well, thank you so much for stopping by to tell us about it. We appreciate it. That does it for us today on